Hey class, today we are going over our last lecture, which includes Chapter 8, reviewing emergency procedures and first aid. So let's jump right in. It's going to be very important to recognize when there is an emergency present or an emergency that is building or about to occur. So this is anytime that a patient becomes suddenly ill and requires immediate attention. So in the ambulatory care setting, you'll see a range of emergency situations. Some of these can be minor, but some of them can be severe and life-threatening. It's important to stay calm and to follow any emergency policies and to also be well-versed in your CPR and first aid procedures. So let's talk about responding to emergency. Let's say a patient comes in and they drop to the floor. We are going to respond and we are going to check what is called the CAB assessment. This is circulation, airway, and breathing. You may have heard about the ABCs, and previously it was airway, breathing, circulation, but it has changed to circulation, airway, and breathing because circulation has been found to actually be more important than that airway and breathing. When two patients present at the same time with emergencies, it's important to do a screening process known as triage to help determine which patient is treated first. So you all know I work in the emergency room, and here we triage each and every patient that comes in, even if there's going to be hour waits, because we need to know, does this patient need to be seen immediately? And then our process is to figure out at which level of care they need. If the patient is conscious, we need to ask them personal information and about their symptoms. We're going to observe their general appearance and then check that pulse and their blood pressure because that's going to tell us about their circulation. So we have some different emergency categories here. First priorities are going to be burns on the face, any airway or breathing problems, a circulation issue of cardiac arrest, severe bleeding that's uncontrollable, head injuries, poisonings, anaphylactic shock, strokes, and then any open chest or abdominal wounds. And then you guys can read what falls in the second priority and the third priority. But remember these first priority ones because those are the ones that are going to be the most important and the ones to be cared for first. So continuing on with our CAB assessment, it actually is continued with the D and the E. So we have our circulation, our airway, and our breathing. Next, we're going to look at disability. Is the patient conscious? Can they respond to our questions? Are their pupils responsive to light? Respond to the provider with any of the findings that you see. And then expose and evaluate. Remove any clothing, obtain a history from the patient, monitor their vital signs, and update the provider as you can. Just to backtrack a bit for the circulation, when we're looking at the pulse, remember to check the carotid artery. That's the artery in the neck, and it's going to be the most easily accessible during those emergency situations. If you do not find a pulse and you are CPR certified, you start chest compressions right away. Airway, if they have a pulse, then the next task is to check their airway. You're going to put your face close to the patient's mouth and look, listen, and feel. You're going to see if they're breathing at all. If they are breathing, support their airway and allow them to continue breathing on their own. But if they're not, you're going to open the airway by tilting the head and lifting their chin with a jaw thrust maneuver. And you learn this during CPR. And then breathing. Watch that chest for rise and fall. If they're only gasping, you're going to help them start breathing, right? They may have that something caught in their airway obstructing their breathing a bit. So I do want y'all to note that we do have Good Samaritan laws which protect us as healthcare professionals. We still have to work within our scope of practice. So for instance, I was never trained to intubate a person, but so if someone were to drop down in the park, I cannot intubate them, but I am certified to do CPR, and so I could certainly do that within my scope of practice. But this is a law that protects us for aiding with emergency situations. This slide, I want you guys to remember when you are responding to an emergency, don't forget your infection control guidelines. Please wear gloves. Please follow proper protocol. Just because there's an emergency doesn't mean that we have to be unsafe and not protect ourselves. So other ways to prepare for an emergency before they happen, you're going to have a policy and procedure manual within your office. You're going to know emergency phone numbers, know the number for poison control. Obviously, we all know 911. Know where our supplies are, updating our CPR certification and keeping that certified, and just kind of reviewing it in your head every so often. Providing a safe clinic environment, making sure there's nothing spilled on the ground that people could slip on, things like that. And then having a crash cart or tray and knowing where that is and inventorying it pretty frequently. So speaking of a crash cart or a crash tray, this is a cart or a tray that has lots of supplies that can be used in various emergencies. Here is a list of all the types of equipment that may be included in these carts or trays. On this slide, there are emergency medications that may be used. You'll see Benadryl is one. Those with anaphylactic shock, you'll be giving them Benadryl. Medications like dopamine, which helps increase blood pressure, epinephrine, that's going to be given during a cardiac arrest, Narcan for those overdose patients, lots of different medications that are helpful in emergency situations. So now we're going to kind of jump into some common emergencies, one being shock. So this is a severe issue that can be life-threatening, and it often follows an injury or illness, but it's where our circulatory system starts shutting down, and so it's not providing enough blood to all of our organs. So when blood is not circulating to our organs, they start to shut down. It is progressive, and if it's not treated immediately, it can be life-threatening. Once it starts reaching a certain point, it can oftentimes be irreversible. There are different categories of shock, and I've listed those there for you guys as well. Here we have our signs and symptoms of shock. I want y'all to be sure to read over these. Some big ones are that the patient will have a low blood pressure. They'll be weak. Their breathing may be shallow. Their skin is going to be really cold and clammy, because remember that circulatory system is not working effectively. Let's talk about wounds for a bit. So wounds are classified as either open or closed, and these are exactly what you think they are. If it's an open wound, that's when the skin is open or interrupted, and closed is when the skin remains intact. So examples of some open wounds are lacerations, avulsions, incisions, puncture wounds, and some of these are emergencies, some of them not quite so. A tetanus injection is usually indicated if you have an open wound. So for instance, those individuals coming to the ER with lacerations that need to be sutured, so to have stitches, they will need a tetanus injection if they haven't had one in the last 5 years. Then you have your closed wounds, and these are like bruises, contusions, hematomas, and a lot of times for these we're going to be doing RICE, which stands for rest, ice, compression, and elevation, or MICE, which stands for motion or movement, and then ice, compression, and elevation. So for those open wounds, you may be tasked with applying a dressing and bandage. Remember that dressings are the sterile part, and they are the ones that are placed directly on the wound. The bandage is non-sterile and is placed over the dressing to make sure that the dressing stays in place. Okay, so let's talk about burns. Burns can be caused by different things: heat, chemicals, explosions, even electricity, and they can be very critical. It can even involve breathing difficulty if you're inhaling the smoke and different things. And there is a way that we discover what percentage of the body has been burned. So you'll see in this picture, each body part has been given a number. And so you add up those percentages as to where the burns are located, and it gives you the percentage of how much of the body has been burned. And this is called the rule of nines. There are different types of burns, as I mentioned. Some come from chemicals, other electrical, and then even solar radiation. So think sunburns can be important to think about as well. We've all heard about different degrees of burns, but these are our classifications of burns. Our first degree, this is going to be our most superficial of burns, and this involves only the top layer of skin. It often causes the skin to be red, dry, warm to touch, swollen, and it's painful, but it can heal pretty quickly without much scarring. Second degree burns are through the first layer of skin and to the underlying tissues. The skin is going to be red and blisters will be present. And it is very, very painful for second degree burns. They can take up to a month to heal, and scarring is very likely. And then third degree burns, these are destroying all layers of the tissue down to the muscle, bone, and nerves. The tissue will often appear charred or brown, may even look white or waxy, raised and leathery. So very tight, very charred, extremely, extremely painful. And if this burn has gone all the way through the nerves, there actually might not be any pain because those nerves have been damaged so much. There is a risk of shock at this point, and it's going to take an extended amount of time for patients to heal from these third degree burns. Okay, so some more musculoskeletal injuries, or moving on to musculoskeletal injuries. These are injuries to our muscles, bones, and joints. Most of them are not life-threatening, but they can be pretty painful. And if they're not properly treated, like if you have a fracture, it can be long-term causing disability. Sometimes it's difficult to determine the extent of an injury just by looking at something. So you'll need to do more assessments, more testing, perhaps an x-ray, things like that. Most injuries, musculoskeletal injuries, can be treated in a similar way, which is that rest, elevation, immobilization, and applying ice, that RICE therapy. Here I've listed some types of musculoskeletal injuries. I'm not going to spend too much time on these because I think y'all have heard of them before, but sprains, strains, dislocations, and fractures. If you're unfamiliar with any of these, please review these descriptions and their treatments. So we do have temperature-related illnesses that can occur. So we're thinking both cold and heat-related illnesses. And these are important because they can be life or death situations. So one is frostbite, and this affects the extremities most of the time. The skin becomes discolored, reddened, pale, yellow, or bluish, depending on how long this frostbite has been going on. And then down to hypothermia. So this is when it's occurring to the whole body, shivering, lack of coordination, slurred speech, mumbling, confusion. And these obviously occur in those colder temperatures. Heat-related illnesses. Now, for us in Memphis, this is a little bit more common than those frostbite and hypothermia. But there is a difference in heat cramps, heat exhaustion, and heat stroke. What I want you guys to do is to read over these symptoms and look at the treatments and the causes, because these do occur in our environments more commonly. So review what those look like. Heat cramps, obviously these are cramps to large muscle groups, not too, worrisome until things like heat exhaustion and heat stroke start occurring. Moving on to poisoning. Poisoning can occur from the body in 4 different ways: ingestion, inhalation, absorption, or injection. Some of those signs and symptoms that a poisoning has occurred is dyspnea, and remember that's difficulty breathing, nausea, vomiting, confusion, and even convulsions, so seizures. On occasions, there's no specific treatment, and that treatment will have to be based on the management of symptoms. So you will be calling poison control for these patients. Even in the ER, we call poison control for our poisoning patients to talk to the experts and to learn how to treat these patients that have been poisoned. I'm going to stop right here, and I'm going to pick the rest of this up in another video. So we'll start back with sudden illnesses in the next video.